All right. For
All
those
right.
of us who couldn't make it today, here we're going to be recording. And in this section, we're going to have some updates. We haven't reached out to everybody for updates, so we have some slides for those who are sharing some updates, and then we'll have opportunities for people to come up off of mute and share anything that we didn't get slides for. But with starting with our slides, I want to pass it right over to you, Elsie, for a pulse on hunger.
Thank you very much. Hi, everyone. My name is Elsie Cipriani. I'm with the New Hampshire Food Bank, and just want to share our updates for this month. I want to start with a huge highlight, which is that we last year in 2025, we reached a milestone, an historical number for the New Hampshire Food Bank, which is that we passed the distribution of more than 20 million pounds of food. That is an increase of 17% compared to the number of pounds that we distributed in 2024. 2024, we distributed 70 million pounds, so we went out more than 3 million pounds. We know that part of this had to do with all the challenges that we had in 2025, but overall, we have seen the increase directly from the mobile food pantries that we do in some areas, but also this is mostly because of the distribution increases that our partner agencies have seen across the state. Towards the end of last year, as you guys remember, many of the food pantries were seeing twice or three times the number of people that they usually see. So we are not surprised, and it's kind of mixed feeling because at the same time, we know that this number describes that the need in New Hampshire is just getting bigger and bigger. Even though it's a milestone for us, it's something that we have to understand that the need is just getting bigger. So in terms of SNAP applications, we have 14 applications in December. As you remember, we were coming back from all the craziness from October and November, so it took a while to get back on track. The total that we had for the year was 235. We are making some changes to our SNAP outreach program, and we, as probably you all know, we're still waiting for the Department of Health and Human Services to provide an update of where the contract is. We haven't heard anything, but at this point, we are prepared to continue private fundraising to continue supporting this program for the near future. So we most likely are going to be adding a staff member, more to come, but we are doing hard fundraising to make sure that we are able to increase the capacity of this program in the upcoming months. So hopefully either myself or Heidi will be providing more updates to this group in the upcoming meetings. So we are kind of excited about that, increasing capacity for that program. Also, in terms of SNAP, I want to share that we are going to, I don't know how many of you are familiar with mRelief, which is a web platform that allows us to identify potential individuals or family that are eligible for SNAP in the state of New Hampshire. This is a tool that is being used by other food banks across the United States. Vermont is using it. I believe that Maine is using it too. And they have reported really good results, like the number of potential applications has significantly increased for them. So that's one of the things that we are exploring. We are about to sign the contract. There is a fee that we have to pay every year, but it's great because what we do is we provide them with the areas where we know for sure most likely there is going to be a high need for SNAP enrollment. And they help us with web resources, with social media and different tools to recruit potential applicants. So more to come, more to share, hopefully in the upcoming meetings. In terms of SNAP benefits, the numbers are there. Can you add a link to this program? Somebody needs the link to the program that I'm discussing. So I'll be happy to, I can put my contact information before I leave so people can reach out directly to me, Sarah, if that's okay.
That'd be great. Thank you so much.
SNAP benefits. So we have more than $15,000 for the month of December. And for the year, we have 261,000 local economic impact of what we are doing within our SNAP outreach, 23,000 for the month of December, more than 400,000 for the total year. And in terms of the equivalent of our programs, we said 20 million pounds, but the meal equivalent of that is more than 16 million pounds of meals that we provided during 2025, which is, again, this is a milestone for the New Hampshire Food Bank. This is the highest amount number of meals that we have provided any given year. And all that is thanks to our partners, because as you know, we don't do a lot of direct service, so this is mostly through our partners. I'll be happy to provide more information, any questions. Yeah. Is there another slide for me, Sarah?
Yes. Now we go to the SNAP outreach. And this might be with Heidi.
Yeah, I don't know if Heidi's in the call, but I'll be happy to go over this if she's not in the call right now. So just a reminder that we have our SNAP Outreach Partner Resource page, and you can scan the QR code. You can request materials. As I said, our SNAP Outreach is currently going through some restructuring. Hopefully we can continue sharing some exciting updates and how we are making this program better and more available to our communities. We have really relied on our partner agencies. So Heidi and Vanessa have been doing a lot of connecting, and they have been hosting outreach events at our different partner agencies, and that has been working really well. We did that because of our limited capacity, but as I shared, if we start using the tools that we are planning to add to the program, and hopefully a new person, that will definitely allow us to do more. So if anyone needs materials, just reach out to Heidi or myself. You can also access our social media toolkit, and more information for a specific materials or a specific outreach event in the future. Just feel free to reach out to Heidi or myself.
Thank you. Thank you so much, Elsie. And if anybody has any questions right now, we can take a moment if you have questions for Elsie.
And I'll put my information here just in case.
Thank you so much. We have a few more updates, so I'll move our slide forward. And I hope that you're ready, Colleen. We kind of moved things up a little bit, so let's bring Colleen on to talk about the network.
Yeah, thanks, Sarah. Hi, everyone. I'm Colleen Jennings with the New Hampshire Food Alliance. We're based out of UNH in the College of Life Sciences and Agriculture. I just wanted to share a little bit about our February Network Cafe, which is coming up next Friday. And the reason I'm sharing about this Network Cafe is we're going to be talking about new work groups that we're going to be starting based on the strategic plan. Sorry, poorly timed bark for my dog. But one of the groups that we're considering is a local food access group. Sorry. And we'd love for this group to be a part of that decision making and hearing about what we're thinking, what you're thinking. So please join us for that. I'll share the link to register in the chat.
And Colleen, I know we had a bit of a conversation in the backbone about this. Can you say a little bit about what we mean when we say local food access? Because sometimes people can interpret that phrase different ways.
Sure. Yeah, the focus would be trying to ensure that folks have accessibility to local food, so food grown by our farmers, our food producers here, which will likely look a lot like supporting programs like Granite State Market Match, Shovel Up Food Bucks, but also there are a number of other food access related programs like low cost CSAs that farms will do. They'll fundraise to offset the cost, or NOFA New Hampshire has a similar program for folks who are in certain income levels. So it's the ability to not only get access to food, but access to that local food that we're growing here in the state. So that will be the focus of that group primarily.
Thank you.
Yeah.
Any questions for Colleen? Thank you for sharing, Colleen.
Sarah.
And I'm going to tap Amy for this.
Yes, so I just wanted to give an update to everyone. UNH Extension is partnering with Dr. Sherman Begornia's lab at UNH. We're lucky at UNH, we have some really great nutrition professors that are focused on nutrition access. And so we are trying, especially with SNAP Ed being gone, we are trying to think about what we, make sure that what we do at Extension is really informed by what people in New Hampshire are interested in and what they want, some of our nutrition education efforts in particular, but also food access. So we're doing a study on dairy and seafood consumption. If anyone is welcome to participate, the inclusion criteria are listed here, and you're welcome to share with other people. There's two parts. So there's sort of like a survey that you can do. And then if you're really interested, you can come to a focus group and tell us what you think. We love that. And so you can participate in one or both of those ways. And there's some compensation for that. It's funded by the New Hampshire Agricultural Experiment Station. And so I will put in the chat, I have to break it into two messages. It's a little bit long. That's some info, and feel free to reach out to me or to the Begornia Lab if you're interested in learning more. And please do share with anyone that you think might be interested if you would like to. Do you have any questions?
Thank you, Amy.
Yeah.
Okay, and just before we transition, does anybody have questions or other updates from partners before we go to the coalitions? All right. So coalition updates, and I think today we have only collected, brought out the screen for the SNAP coalition. I don't think Heidi is on the call at the moment. I will just present the slide, and then if Laura or Elsie wants to add anything. The SNAP Coalition meets every month on the third Wednesday, and this is a really important opportunity for people who are working with SNAP recipients. There's a lot of information about all of these changes that can be very confusing when they're rolling out, and how that might be impacting your client population. And there's also really great discussion about advocacy opportunities and policy work that's going on around these issues, and reminders about how we can help people with applications to SNAP and trying to close that SNAP gap that continues to be really big in New Hampshire between those who are eligible for SNAP and those who are enrolled. And so there is a mailing list here, and Heidi is her email is listed here if people have specific topics that they want to talk about. So Laura, anything else you want to fill in about the SNAP Coalition?
No, I'll talk about the policy later, but that's in the legislature. But I just wanted to say that people may start to see people who have been who are affected by the changes in the work requirements. People who were not subject to the so-called ABOD rules, the able-bodied adults without dependents rules, may have become eligible because of the changes in the reconciliation bill. And those people get 3 months to be on SNAP without having to meet the work requirements. And those 3 months are starting to be up. So if people are seeing people who are thrown off SNAP and they didn't know about it, or they don't know how to meet the work requirements, I would refer them to New Hampshire Legal Assistance or to 603 Legal Aid, actually, because that's the input that's how you get to legal assistance. Just to say that, and there's lots of information that we can share at the SNAP Coalition and feel free to contact me if folks have other questions.
Thank you. Anything else about SNAP Coalition? Questions? Okay. Any other coalitions? So we didn't reach out for coalition leaders, regional coalition leaders to prepare slides this month. It's just been a very busy month, but this is an opportunity that anybody is welcome to come off mute if you have any announcements. I know, for example, in the Seacoast region, you have a legislator breakfast coming up. Anything you want to drop in the chat about events or announcements you want to make now about your coalitions. Here's an opportunity. Okay, so now I'm coming back to Hunger Solutions team, and we are going to have a little bit of a walkthrough of the pieces of legislation that are in process in New Hampshire now. So,
Sarah, before we move to the next one, can I actually add one quick update? I just wanted to let everyone know that's on the call. I don't believe she's on the call, but Heidi Barker that works with UNH Extension, a lot of people know her. She's been an active part of this coalition for a lot of years and on the leadership team. So she is retiring. We are wishing her well. She's leaving in a few weeks, I think February 13th. And just so everyone knows, feel free to reach out to her. And I know it would mean a lot to her to hear, well wishes from people if you've worked with Heidi. And also, we are still in the North Country UNH Extension. So I just wanted to mention, I know Heidi has done so much. So it's like kind of like, wait, what? If Heidi's gone, who do I talk to? So we have someone in the North Country that some of you know, Ziani. In Coas County, we also have Joy Gagnon who runs the Carroll County Food Access Network. But in the same office as Heidi, we have Ziani, and I just stuck her information in the chat. You're welcome to connect with her about anything going forward that you would have connected with Heidi about. She's super well connected. And just wanted to mention that. I'm really going to miss Heidi, and she's been a great part of this work, and she's the reason I joined the leadership team, honestly. She's like, I think you should be on the leadership team. So really appreciate her.
Wonderful. Thank you. Thanks so much for that, Amy. I think a lot of people have gotten to meet Heidi, and we hope we see her again and she'll be out there on her new adventures. All right, so we're going to turn attention to legislative priorities in 2026. And I think that's you, Laura.
Great. So New Hampshire Hunger Solutions has a number of legislative priorities and if you can go forward in the slides. So our top priority is to ensure that we can run the SNAP program the way it's been run, which because of the reconciliation bill means that we need to come up with a $4.6 additional million in administrative costs. It used to be that the costs were split 50-50 between the federal government and the state, and now the state is responsible for 75%. So the additional 25% is that $4.6 million. There was a hearing in the Senate on the 20th of January. That went well. That bill would require that the dollars be found in the DHHS budget. There's another hearing that is happening next Monday. Sorry, it was I updated different slides here. I'm sorry that these didn't get updated, but it's happening next Monday. It was supposed to be last Monday, but it got snowed out. So we're on February 2nd at 11 o'clock. And that bill would appropriate the additional $4.6 million from general funds. And that's being heard in House Finance, which is not an easy committee. So if you so please weigh in. We need people to contact the committee. And we have sent out action alerts. You should have seen them if you're signed up for action alerts. If you're not, you can see them on our website. On the policy page, you can make your voice known with the committee. Okay, next slide, please. Brianna, do you want to jump in on the school meal?
Yeah, sure. So my name's Riona. I'm the Deputy Director at New Hampshire Hunger Solutions. I do just want to preface this that we are nonpartisan. We work with both sides to just end hunger across New Hampshire. School meals related bills, SB 517, raise eligibility for free meals to 200%. The federal poverty level, the hearing was yesterday morning. And we had some good in support. We do feel as though there's opportunity in which we can pass this in the Senate. This bill was last year passed in the Senate. We feel as though there is opportunities still for individuals to reach out to the senators to tell them why it is important to them as constituents to raise the eligibility to 200%. HB 1574, extending free and reduced lunch for special education students up to age 22. Last session, 23-24, there was a bill that was passed to extend special education for transitional students up until their 22nd birthday. So that's where this came into play, in which there was no free reduced meal applications for those students 21 to 22. This bill was heard, I believe, on the 14th. Most likely will be killed because federal reimbursement is not eligible for those over the age of 21, or there will be an amendment in which we would help support. There will be more information to come. Just because there's so many administration changes that would have to happen, the bill just needs to be worked on a little bit more. So we are in connection, and if you have an individual who is an adult over the age of 21 in that transition in public school where there's National School Lunch Program, please reach out to your local senator or representative to get that word out there so the Department of Education can have more understanding. Next slide. Laura?
So this is a bill, HB 1727 was heard also on January 14th. And it would allow, right now there is a law that doesn't allow the Department of Education to have child level data. And that is a barrier to the Department of Education sharing the data on who's on free and reduced meals with the Department of Health and Human Services for the purposes of mailing out summer EBT cards. And so what they've been doing is setting up a portal for EBT eligible families. That's families who are in the free and reduced meals during the year, so that they can sign up to get the additional EBT card in the summer for summer EBT. And what we hear is that there are something like a little under 5,000 families who are in this category, but only about 60 applied through the portal. So that's a lot of families falling through the cracks. And so we're trying to carve out an exception from the law to allow for there to be data sharing for the purposes of getting those kids fed. Next slide. And then there are a number of bills that attack SNAP or try to substantially change it in ways that would add cost. SB 615 and HB 1797 are the same bill introduced, one introduced in the Senate and one introduced in the House. They limit what SNAP recipients can buy with their EBT cards. And that, frankly, is the best part of the bill. It also would remove categorical eligibility, which is the mechanism by which we increased eligibility to 200% of the federal poverty level in New Hampshire. That would also bring back, asset tests, which so few people on SNAP have any assets at all. And it just adds administrative burden for the state, and possibly gets people cut off the program who really, who have any savings at all. And it it actually punishes work, because if you make a little bit more, then you can get cut off the program. So we had a hearing on SB 615. Oh, and it also adds a whole bunch of data matching that is both unnecessary and incredibly expensive. So there was a hearing on the 14th. Thank you to those of you who were there. We had a great turnout. I think that the Senate Health and Human Services Committee is concerned about a lot of pieces of the bill. Many of them are enamored of the SNAP restrictions part, the part that would not allow people to buy candy or soda. And I have a couple of slides about that after this, because we've been getting a lot of questions about why we're opposed to SNAP restrictions. So there's another bill also that has not been scheduled, HB 1773, and also HB 1797 hasn't been scheduled yet. So we will come back to you and ask for your help again for those. Next slide, please. So why do we oppose SNAP restrictions? So it turns out that there's a fair amount of evidence that shows that SNAP restrictions don't actually improve diet quality or health outcomes. The restrictions ignore the real drivers of poor diets, which are not having enough money to buy healthy food. Healthy food is expensive. And also lack of proximity to full service grocery stores. There are many parts of the state that only have convenience stores near people. And so it's hard to access healthy food. And the studies show that diets of SNAP participants are not different from those of people of similar incomes, which tells us that the problem is not the SNAP card. The problem is not having enough money. And finally, the chaos that's being created in the states where, so USDA has offered a waiver, which a number of states across the country have used, which would allow barring candy, soda, or sometimes it's worded as sugary drinks. And there aren't like standard codes that people can put in. So states are making up, codes. And as we know, products come out all the time. So it's incredibly expensive for the state. It's incredibly expensive for retailers, which we worry will cause retailers to turn away from the program. And it erodes dignity. I mean, you can imagine a retailer, sort of like stopping somebody at the checkout because something came up as not allowed. And then, and that slows down the line. And it just, once somebody's been through that, the likelihood that they're going to want to use SNAP again is lower.
I do want to just have a little poll here. If we all can just think of these 3 items, you're at the checkout line and there's Twix, Snickers, and a Milky Way. Do you all put in the chat which one is actually considered not a candy bar? Twix, Snickers, and Milky Way. Give it one more minute. It's actually Twix. Twix contains flour. It is not considered a candy bar. So you can see how hard it will be for local grocers to individualize, split out all the candy and figure out which is a candy bar, which is not, because of those restrictions. So I do want, on local grocers, this is a lot of man hours. It's going to just put a lot of stress on the local economies, those local grocers, and it'll persuade them to not want to allow SNAP at this time. So we don't want any more food deserts. And it was just eye-opening to me when I learned this. So I'm glad you all learned a little bit today. Thank you.
Next slide, please. So I think I've already said this. Yeah, this is the part about retailers and the state budget. So, so thank you. We can move on. Do people have questions? please follow our action alerts and weigh in when things when we ask you to contact your legislators. It really, really does make a difference. Thank you.
If you're living in the North Country, if you're living in Derry or Londonderry, please reach out to your senators to talk about how
Or Nashua.
this in Nashua. Thank you. Please reach out to the senators. They are on the committee
Health and
for
Human
the
Services Committee.
for SNAP restrictions, and we really don't want to push people away from SNAP, especially local grocers.
Thank you, Riona and Laura. That's very informative. Even though in being in Hunger Solutions, I get to hear this a few times. It's pretty complex, and but it's really basic, right? Like anything that's going to increase the difficulty of accessing SNAP is going to knock people off. And that's very, very difficult at this time when food prices are already so much higher than they had been before. So I'll just give one more moment if people have questions for Riona and Laura, comments, anything else in New Hampshire state policy around food access. So I'm just going to highlight, we are not directly working on federal nutrition work right now. We don't have any action alerts out there, but just to always point out that the Food Research and Action Center works very hard on keeping a pulse on things that are happening in Washington, D.C. There is an effort to try to repeal some of those harmful effects on the SNAP that came out in the budget that was signed in July. And there is an effort in Washington, D.C. to reinstate the USDA's food security report, which was a really like the key component of information that we have around understanding the state of food insecurity. So there are some opportunities to engage in advocacy at the federal level. Questions, other comments? Federal policy.
Sarah, on the hunger report, is it being reconsidered at the Senate level, the congressional level, or both? Do you know?
I don't know.
Okay, that's
Yeah.
fine. No problem.
There's a
Laura,
bill.
surely
There
need it.
has a bill has been introduced, but I don't know where it is at the moment. But
Okay,
I'll send you a
no
link.
problem. Thanks.
and
Thank
there's a
you.
link at the bottom here. I think that they can, if you go into the FRAC website, you can get all of those questions answered, and they're keeping
Perfect.
all of that. All
Can
right.
I ask a question, Laura? And I'm sorry, I had to step away for a second during that presentation. I had a repair person here. But is it SB 615, the one that's threatening SNAP? Would that, if it's passed, reduce SNAP to 130% of the federal poverty level as eligibility?
I mean, the short answer is yes. It does depend on for older adults if there are different levels and different asset tests, but yes, it would roll it back.
Okay. And just for around like 130% is like for a family of four, that's like $40,000 a year right now. If you can qualify for SNAP, if you make that same family makes up to like $65,000 a year. So that's the difference we're talking about. If that's just helpful for people, it's helpful for me. So thank you, Laura.
And then if you look at the MIT cost of living, none of the counties get by for a family of four, even at the 200% of poverty. So I think this is really sobering and a step in the wrong direction. Thanks.
Indirectly, it would kick those individuals off of free and reduced meals from SNAP. About 6,000 kids would be affected in school meals who are directly certified through SNAP.
Thank you. Well, I think we're ready now. We're going to shift into our next section. And oops, let's make this a slideshow. All right. And I will hand it over to Amy.
All right. So for the next part of the agenda, we're going to be talking a little bit about January, right? Thinking about the year ahead. So as a backbone team, Sarah and Tara and I have been reorganizing around, kind of who we are, what do we do, what did we accomplish in 2025 that we want to share out and give people a chance to talk about, as well as some goals we're thinking about for 2026 and get some feedback from people. So I am going to kick us off with sort of a little bit about who we are and the structure of our coalition, and then I'll turn it over to Tara to talk about what we got done in 2025 together, and Sarah will finish this up with what looking ahead to 2026. So that's what we've got for the rest of the meeting. So the structure we use when we say like a backbone team too, I've got a slide about that in a minute, but the structure we use, like where that all that comes from, we have our leadership team, we have our backbone team, we have our work groups, and how we try to work in this coalition is it is based on a framework for effective collaboration that New Hampshire Hunger Solutions introduced me to at least a while ago. And here's sort of a visual that we use. And the idea is that, for a coalition to be effective and collaborate together and actually achieve stuff, we have to have a common purpose. So in a second, I'm going to tell you where we're at with that based on 2025, kind of what our current vision and stuff is. And hopefully that resonates, and we should always be updating that and sort of making sure for all of us that that stays relevant to like why we're here and represents, the members of the group. And then there's other things that like make effective coalitions that we're just thinking about when we're trying to make sure that our work is impactful and the time we spend together is well spent. So having mutually reinforcing activities, having backbone support, so sort of like facilitation for the work of the coalition, that's different than leadership. Trying to measure what we do, not to spend tons of time on that, but to be able to talk about our impacts essentially. A strong ecosystem of partners, good communication, funding, shared accountability, all of those things. So that's sort of, this is the framework that we use to sort of guide this coalition and some of the work groups that are under it. We'll go to the next slide. And I won't spend too much time on this, but it is in the slides, just kind of defining some of these things. If you're interested in this stuff, what is backbone support? What is, shared accountability? So just a little bit of language around some of these things that we are referring to. And then our coalition design for the New Hampshire Food Access Coalition is, we have our backbone support team. So, but we also have, and that's sort of like facilitating the work of the coalition, the agendas, setting up the meetings, sending out communications, all of those things, providing resources. And then the leadership team is a more of an advisory group or like a steering committee. So we have one of those. And then the work of the coalition mainly is happening through different work groups. And we'll talk about what those are. But work groups that are based around goals that fall under the umbrella of like improving food access and nutrition in New Hampshire. So this is very loosely our sort of structure that we follow. So who is our backbone team? So me and Sarah and Tara are the backbone team. Tara has been on the backbone team. It was her and Tiffany for a long time. In 2025, Tiffany took another job. So when she left us very well set up with lots of resources that we're still tapping into. Sarah then joined the backbone team from New Hampshire Hunger Solutions. And I was able to join from Extension. And so the three of us worked together to try to create those agendas, facilitate the meetings, listen to people, incorporate their feedback, and try to do some of the behind the scenes stuff. To even today, I was tasked with setting up the breakout rooms for this group, which was great, but a little nerve wracking. So that kind of support that keeps the coalition running is that you've got the three of us that you can come to. And our leadership team is always evolving. But right now, we are really grateful to have an awesome group on our leadership team that we meet monthly with. We talk about agendas, we plan for the future, we dig into, some discussion topics like, where is the overlap between local food access and, healthy food for all, like kind of what Colleen was mentioning earlier. So our leadership team is Tara Lynn from Dartmouth, Shirley from the Office of Health Access, Joanne, UNH and New Hampshire Hunger Solutions board member, Jess Gorin, Hunger Solutions consultant, Colleen with the New Hampshire Food Alliance, and then of course Elsie, who you heard from earlier with New Hampshire Food Bank. And then the work of the coalition, some of the major projects we are working on, major goals that you'll hear a little bit more about, is carried out through our state working groups. So we have our SNAP coalition that Laura and Sarah gave some updates on, and often you hear from like Heidi Johnson at the food bank. So we'll talk a little bit about that and what we accomplished in 2025 in a minute. We also have our New Hampshire Nutrition and Health Equity Work Group that is led by Jess Gorin, bringing together, people in the healthcare sector with community-based organizations to do, work around things like hunger screening and referrals, and maybe even, medically tailored meals, produce prescriptions, sort of food as medicine kind of work. Then we also have our New Hampshire Nutrition Action Research Network. And so coming together around what are the needs? What do we know? What does the data say? Is it aggregated? Can people act on it? And we also have our New Hampshire Farm to Early Care statewide group. So these are all, and this is a group that's working on, they just started this summer officially, working on local food procurement and gardening and education for early care like Head Start and also other child care centers in New Hampshire. So these are some statewide working groups working around goals that fall under the umbrella of the New Hampshire Food Access sort of coalition and Healthy Food for All. And then we also have our local and regional FACs who we try to support, and we have some goals around strengthening support for them this year that we're really excited about. But it's so awesome to see this map. I don't know about all you. I love seeing like that we have all of these regions covered. We have people working together on local food issues. So if you want to come together with people sort of geographically close to you and work on hunger in your communities, these are the groups to join. And so we have all of those, and it's a goal of our Food Access Coalition to try to support these local and regional groups as well. And then we have our partners. And so we will probably update this at some point this year, but this was taken last year asking people who's coming to the coalition, what sector do they represent? So you can see lots of nonprofits, good amount of healthcare organizations and government organizations, university, schools, and lots of community members, which is really great, along with some of these other areas. So we like to know, who's coming to the FAC and in what capacity, and if they represent a sector, what do they represent? So this was taken about a year ago. Okay, and so I'll just this is our mission and goal. This is our mission and goals in 2025. We haven't updated these yet. We're always open to doing that, but right now this is where they stand. And so I will introduce those, and then I'll hand it off to Tara to talk about what we did in 2025. So our vision is a diverse, well-connected coalition that uses its collective voice to ensure that all people in New Hampshire can achieve nutrition equity and participate in creating a sustainable, resilient, and just local food system. So we dream big. And how do we do this? We connect stakeholders, raise awareness about root causes, promote collaboration, and empower advocacy efforts to foster nutrition equity for all people in New Hampshire. And these are our priority areas that we established last year. So priority 1 is engaging and connecting, diverse communities and organizations. And these are a bit on a continuum. They're all interrelated and they sort of build on one another. So hopefully that shows at sort of the bottom where we pulled out the main themes for each one. Priority 2 is to educate people about hunger and its causes, as well as learn together, foster shared learning. Priority 3 is to collaborate to actually start to address some of these systemic and root causes of hunger and lack of nutrition and food access. And number 4 is really building power among all of us as leaders, community members, organizations to advocate for equitable access to nutritious and sustainable local food. So those are our priority areas. And Tara is going to share with you now some of the stuff that we were able to accomplish together in 2025.
Thanks, Amy, and thanks for kind of framing, what the coalition looks like and what our goals and mission are. I think it's helpful background, especially for anyone who is kind of newer to the group. But yeah, so we're going to talk about some of the accomplishments we had in 2025. You probably, if you joined the call in June, we gave a kind of brief update at the 6-month mark, but now we're going to kind of look back at the whole year, which feels like it was not that long ago because it really wasn't. Sarah can go to the next slide, please. So, kind of our first accomplishment we want to call out is strengthening communication around hunger and food access. So, we provided some timely information when there was government shutdown happening, and even before that, when there was some kind of uncertainty around like some funding and program changes. So making sure that we kind of dedicated time to discuss those things and talk as a coalition and try to address those. And the SNAP Coalition is one of those working groups that is continuing to carry out that work, as you heard from Laura and Elsie earlier today. And then another piece that is related to this is delivering relevant communications around advocacy. And I'll let Sarah kind of give a little bit of a highlight about that on the next slide.
Thank you, Tara. So just looking back over the 2025 year, through the database that we're able to track when Hunger Solutions sends out advocacy alerts, we're able to see your responsiveness to them. So we can see that over the year of 2025, we had 535 advocates around the state who touched base with 356 of our state legislators. You sent 5,108 emails and 1,946 letters. Letters are, you may have sent those, printed them out and sent them physically to your legislators, or taken them to the State House and given testimony. And you can see the breakdown across the state of where people engaged in these activities. So thanks, Tara. I'll let you carry on.
Thank you. And then our second kind of bucket of accomplishments for 2025 falls under enhancing collaboration and community building to address hunger. So, we provide a platform for partners and coalition members to share what's going on across the network or across the coalition. I think in September, we heard from a lot of the regional coalitions about some of their projects they have going on and some of the goals they have for their work. And we wanted to call out some of the work of the Nutrition and Health Equity Work Group, which Amy kind of shared a little bit about that earlier. But I don't know if Jessica, if you're willing to come off mute and kind of share a little bit of the highlights of what's going on with that group.
Tara, thanks. Yeah, it's been really exciting to see this group in 2025 and how it moved forward. We increased our participation from about 12 members to over 60 members. We have a wide variety of membership from healthcare partners to public health partners and large community-based organizations. We spent a lot of time this year learning about Medicaid waivers and how we can work with our Medicaid partners to improve access to food and nutrition resources in the state, get more people connected and enrolled in SNAP, WIC, and school meals, as well as participating in other programs. And to do that, we have to kind of understand workflows. And so we worked with the Foundations for Healthy Communities and put out a survey and collected over 17 health system surveys to understand food as medicine projects, but also to understand their workflows around screening for health-related social needs and getting people connected to nutrition resources in their community. So more to come this year.
Thanks so much, Jessica. And yeah, I can agree, like seeing the increase in participation has been really awesome for that group. And as far as our kind of third bucket of accomplishments, kind of really centers around leadership related to nutrition access data and resources. A lot of partners who participate in this group, including Hunger Solutions, UNH, NOFA New Hampshire, Dartmouth Health, and the New Hampshire Food Bank, and myself, we all kind of worked together to co-author the Nutrition Access and Security Brief as part of the New Hampshire Food Alliance's New Hampshire Food and Ag Strategic Plan. What a mouthful. We also brought a bunch of partners together in October to talk about where we stand with data as a state and how we can work together to kind of address that with the absence of the food security survey that was issued, most recently being the last one for now. Laura spoke a little bit about that earlier. And then some of the work we want to highlight related to the Nutrition Action Research Network, also known as the NARN, is kind of those members are starting to design a study on client experience. And Amy, I don't know if you want to talk a little bit about that.
Yeah, I think we've in that group, we're bringing together partners from Dartmouth and research partners at UNH, along with like community-based partners for input. And we've been exploring just how to do research in a way that's really in partnership with the community and benefits the community. It takes a lot of heads working together. So I think this year we've made great progress, and we submitted a proposal. It wasn't funded, but it was a great process to try to get funding and try to document, what we want to do. And we're continuing to work together to try and design that study and document the experience of people when they try to access or participate in different nutrition assistance programs like SNAP, WIC, school meals, et cetera, in New Hampshire. That's what that group's been up to. And yeah, we didn't get funded, but you guys know it was a hard year for funding. So I think, just getting it all on paper and writing it down and continuing to move forward, that has been great. So, and thanks to Jess Scorin in particular for your leadership with that group. It's been really helpful.
Thank you, Amy. And then lastly, kind of the last bit of accomplishments we wanted to highlight is related to building capacity and creating collective food security impact. So adding a third backbone team member has been really helpful in planning. And before Tiffany left, we drafted a backbone team charter that has been really helpful for adding the new backbone team members and kind of orienting ourselves around what that looks like and setting goals for ourselves and for the coalition as a whole. And then community of practice started to be launched at the end of the year and is in the process of being scheduled quarterly. I don't know, Sarah, you want to speak to any of that briefly?
Sure. So a community of practice was a long time goal. This community of practice particularly is for those who are um, leading and coordinating the regional food access coalitions. And we had our first meeting on January 12th. We are planning to meet on a quarterly basis, but also one of the one of the pieces that was heard loud and clear is finding a platform and sharing resources on a platform in between meetings, trainings for people, best practices, tools, things that any coalition could use to enhance their work to navigate different times of challenge, whether it's a startup phase, whether it's work planning and those kinds of things. So keep an eye out for more information.
Thanks, Sarah. And then I think now we just kind of want to open it up to you all. And if anyone wants to share, was there something we missed that we should highlight? And then just kind of wanted to do a pulse check on ensuring we're meeting the needs of why you're participating. So if you want to come off mute or share it in the chat, we'd love to hear from you all about what you think.
I have a question. Hands raised.
Yeah, go ahead.
Hi, guys. You showed that slide of like all the different various partners from different sectors that are part of these coalitions. Like, how do you define what partnership is and get people to either join the coalition officially or unofficially? Like, what does that process look like?
I think Tara can speak to this if you intend, but I think it's been more just who's coming. It's pretty loosely defined right now. Like if you're coming, and then what sector do you identify with? If you had to pick one of these. But certainly in the future, if we were interested in like drilling down more on that, there are resources we could use. But Hannah, to answer your question in terms of how that data was collected, I believe it was just who's coming to the meeting and answering what sector they identify with. But Tara, do I have that right?
Yeah, I'd agree with what you said.
Thanks for being here, Hannah. Love Sweet Beat. Shout out.
Thanks for sharing, Zandra. Yeah. Any other questions, comments? Joanne shared power of building relationships and supporting our diverse efforts as we collectively build skill and will to end hunger in our state. Yes. Thanks, Joanne. Yeah, we'll pause for another second, and then if not, we can unveil some goals we have for 2026.
I think I am taking lead on this portion of the presentation. So we also, I want to shout out to Amy for organizing our thoughts on this slide. And Tara, thank you so much for all of the work and continuity that you bring. It's been a really fun team to work with. And it's only been a few months, so we're very excited as we build up momentum together and momentum with all of you on the call and beyond. So we're continuing to align with the goals that we've already talked about today. And in the area of strengthening communication and shared learning, where we continue to work on creating clear channels for sharing updates, sharing information about emerging issues and best practices. As well, we're keeping members informed and connected through opportunities for networking, relationship building, and collaboration. And we're fostering shared learning among coalition members. And so this aligns with our priorities of engaging and connecting and our priorities of education. So more will emerge over the year on these. We also want to demonstrate collective impact. So right now, what we're talking about in this coalition is facilitating a session at the 2026 New Hampshire Food System statewide gathering that's coming up in April, creating, as well as creating an impact report after this year is completed, and making a pattern of creating these reports, and that will highlight coalition accomplishments, and that aligns to our goals of education and collaboration. Around our goal of advancing alignment and advocacy, we want to support our advocacy efforts, strengthen nutrition access policies, and especially this year, of course, we are all pulling together to ensure continued SNAP funding in New Hampshire. And we are also supporting the working groups that Amy described at the beginning of the presentation, and the community of practice that I just described a couple of minutes ago. And this aligns with collaboration and building power. So those are our major areas that we're working on. So I'm going to stop share again and give us an opportunity to raise any questions or comments. I know these are broad strokes, feedback. And I think the next thing, and last year when we had our January meeting, we kind of moved into this direction. We don't have a lot of time, but I'm going to go back to, I'm not seeing any questions, so I'm going to go back to sharing the presentation. Thinking about how each of your work aligns with this. So I'm going to go back to you, Amy.
All right. Well, I just stuck in the chat the sort of broad goals too, so people can sit there and ponder them a little bit if you'd like, and feel free to put any thoughts in the chat. Love to hear what your organizations are up to that is related or tangential to this. Feel free to reach out to us outside of the meeting too and share as well. But we always want to end with sort of like how to take action. And I know that's one of the reasons people come when we listen to our members. A big thing people come for is the partner updates and the networking. And like people said at the beginning of the meeting, like getting to know other people, but also people do want to take action too. And it's hard because there's so many things. It feels like every day there's more and more things we need to take action on. But we do have some capacity built right now to work on certain things. So we just want to highlight what's going on currently. And then also if you see gaps and there's working groups we should be developing or goals we should be considering, like feel free to share those with us, because these didn't exist a while ago. They came up to address needs, and they can continue to evolve to meet needs and meet the issues that people are seeing in their communities and that your organizations are working on. So right now we have some statewide working groups that I mentioned at the beginning. So we have our New Hampshire SNAP Coalition that are really focused on SNAP and the SNAP program. And that's incredibly important in today's climate with the changes that Laura highlighted that we anticipate coming. So they are very focused on that. We have our New Hampshire Nutrition and Health Equity Work Group that Jessica came off mute and spoke about, where we're bringing together healthcare and community-based organizations and partners addressing food as medicine, hunger and health-related social needs, screenings and referrals, those sorts of things. And we have our Nutrition Action Research Network as well that are working together on the client experience study and really understanding the research and the literature and that has already, what's already been done, needs assessments in counties like Monadnock and Carroll County, that the data that we have about nutrition access in New Hampshire, as well as the stuff that we lack. And then we have our New Hampshire Farm to Early Care Education Coalition as well, working on local food procurement, gardening, and education to support those things with our ECE centers. So those are some statewide groups we have right now. But we also have our local, and so then again, so those are more like issues and thinking statewide, they obviously affect local communities, but it's great to get involved with your local community around, just geographically around like food access and the issues that you're seeing. So we have these different local groups, and we have listed their upcoming meetings. Hopefully these are all up to date. Let us know if you're part of one of these groups and we believe these are correct. But we have, the North Country is forming. They have a work group right now. They're forming around a group wanting to really address hunger and nutrition access up there. There's been work going on up there for a long time, but sort of forming a new working group right now. And the Carroll County Food Access Network. We also have the Upper Valley Food Security Network, Lakes Region Food Access Coalition, the Capital Area Food Access Coalition, the Greater Sullivan Council, and the Monadnock Food Access Alliance. In Hillsborough, we have our Manchester Food Collaborative and our Greater Nashua Food Council. And then on the Seacoast, we have the Greater Dairy. Well, I guess that's not quite the Seacoast. That county's on the Seacoast. But we have the Greater Dairy Food Council. And then we have the Stratford County Public Health Networks Healthy Living Work Group that really focuses on food access. And, also I know Allison is here, the Seacoast Food Providers Network as well is over that way. So lots of different groups that you're welcome to get involved with. I will put a link in the chat. If you haven't seen this page, check it out, bookmark it. I use it all the time. Hunger Solutions, there is links on this page for all of these groups, statewide and local coalitions, and how to reach out to them. So 11:24. We are perfectly on time. We have 5 minutes. Just as we end, this is us. So Tara, Sarah, and I are the backbone team that put together this presentation with our leadership team support and help and everyone in this coalition's input, including our working groups and everything. But yeah, any final thoughts, things people want to share, you can put in the chat. You can come off mute. We have 5 minutes for discussion. And you're welcome to drop off and get on with your day as well. We really appreciate you being here. So Tara, Sarah, anything you want to say?
I want to say we did not update this slide. Today is January 28th. Our next meeting is February 25th, I think it is. So, and I think Tara, you were going to wrap up for us.
Oh, I didn't know if Hannah wanted to speak a little bit more about the potential Kearsarge Food Access Coalition, and if you don't want to, that's okay too.
Yeah, no, I'm soaking up all this great info of what a coalition is and what it does. We've been developing this thing called Feed Kearsarge since 2020 in the Kearsarge region. We were calling it a network, generally just now I'm learning as a coalition and learning all these resources to help understand what that is, what that means, and why people would want to be a part of it, which is a big goal of mine in 2026 as kind of one of the leads with our partner organization, Kearsarge Neighborhood Partners, to really further develop this coalition. Certainly in a rural area like our Kearsarge region, it's about 7 rural towns. There's a lot of little tiny efforts happening all over the place, and many people don't know each other, and there's lots of opportunity to share resources and just know each other, as well as better understand the problems that we face and better communicate. So I'm really excited and also a little overwhelmed about this coalition building work. Super grateful for all of you here. And one kind of tangible thing we're working on is creating this food security summit in April. Sarah, I hope you got my email that the date has changed. Hoping to have New Hampshire Hunger Solutions there presenting on what a coalition is, what it does, as well as the Center for Advancing Rural Health Equity presenting on some data that we've been collecting from our region and what food security looks like here, specifically for our neighbors in the Kearsarge Regional School District. And then we're going to have a really exciting panel on kind of that last mile of the different and interesting creative ways people get food from where it's grown or whatever to people who need it, including community freeze model that we utilize here at KFH, discounted CSA shares, food pantries. And so we're hoping to kind of frame the problem, get a sense of what a coalition is, and leave the day with some solutions and hopefully more connections to continue figuring this all out together. So I have hopefully permission, or at least some contacts here, to send info out to everybody about that, and hope to see some of you there for sure.
That's so exciting.
And nerve-wracking. It's great. Great. It's going to be great. Thanks, everybody.
Yeah, thanks so much for sharing, Hannah. Any last thoughts or comments before we officially wrap up?
Just
I didn't see any.
highlighting
Oh, go
that
ahead.
look, we have a puppy. Just highlighting that for our next meeting, which is the 25th of February, we are going to put a spotlight on child nutrition, on school feeding, and especially school breakfast. So looking forward to sharing information about that with all of you. And with that, also highlighting that topics can be suggested to us for the special, for the deeper dive presentation segments. So please let us know if you have ideas and topics that you want to take deeper dives on these meetings.
Yep. And with that, thank you all for coming, and we'll see you next month.
Thank you, everyone.
Thank you.
Bye.